I'm Dr Natalie Cawley, the author of Just About Coping, a real-life drama from the Psychotherapist chair. It's a memoir about my training to become a counselling psychologist and psychotherapist, which mostly takes place in an NHS hospital. It was my first day on the psychiatric ward. My new colleague, the psychiatrist, was waiting to meet me on the other side of the locked doors. I nervously shook his hand and he walked me down the hallway of rooms, giving me details on each patient. They were a complex bunch with extensive stories and medications, many of which I was not familiar with. I was impressed by the psychiatrist's knowledge of each individual and their specific needs. This continued for some time, until a voice came from behind me. "Bill is leading the new psychologist around like he's the consultant again." The man standing next to me, who I had believed to be in charge, began yodeling and wandered off, leaving me staring at his receding back. And the voice behind me continued, "Bill compulsively lies, or maybe he believes he is the psychiatrist, who knows? He's been with us for 6 months, never gets old." The real ward psychiatrist told me. I think we lie to ourselves to get through things sometimes. Lying can help you cope because you invent a new reality and distance yourself from the actual reality that's causing you discomfort or distress. Problems can arise when people lose touch of actual reality. So if they embody that false self too much, it can become a delusion. Noah comes to see me for help with procrastination. We talk about procrastination being a self-sabotaging strategy. Putting things off only makes them more difficult to confront. I ask Noah for specific examples. How much is this impacting his functioning? Noah says he's really here to ask how to write a text message to break things off with his partner of 4 years. Patients wanting support with communication or writing text messages like this is more common than you think. He's been putting this off. He's been procrastinating. "I can hear the fear for you, Noah," I say, of being able to take assertive action. But do you think a text is sufficient to show respect to this bond that has lasted for 4 years? Noah is too anxious to face this head on and cannot entertain the idea of a more direct approach, even with my support. After role-playing the conversation and planning his escape from the discomfort of the situation, he eventually says he'll just have to find another way. Noah finds his own solution. He pretended to go blind. He met up with his partner wearing thick, dark glasses and told her they'd suddenly lost his sight and he needed to get through this alone. I marvel at the lengths people will go to avoid conflict. Still, it seems to have worked. Yeah, our coping mechanisms can often seem paradoxical, like procrastination and self-sabotage, but we often feel compelled to repeat things that are familiar, even if they're damaging, unhelpful, or infuriating. To normalise the unhelpful coping behaviours, I think sharing my story and patient stories answers the question that it's not abnormal, it's not strange, we're all just trying to find ways of coping. And some of them, if we keep them secret, we can attach shame to them, and then they can become the problem themselves. Harry returns to see me, and as soon as I see him in the waiting room, I feel pure relief. Harry is 17 and very anxious, crippled by social anxiety. He blushes every time he tries to answer a question. So I've decided that for the next few sessions, we will just play cards. While Harry is engaged in the game and distracted by the process, he's able to talk more easily and I see him relax in my company. For now though, he remains resistant to talking about the something. After 2 sessions of cards, I bring in a small cardboard box and place it between us. I tell Harry that the something is in the box. We don't have to open the box and look at it, but we can talk about the box itself, how it makes him feel, how carrying it feels, and what it means for this box to exist. Harry says he feels preoccupied with the box at all times, that is taking over his life and makes him feel terrorised. The sheer weight of carrying whatever the box holds feels so distressing and isolating. He tells me that he has at one time considered taking his own life because he feels alone and hopeless. I feel connected to Harry and I feel a pain in my chest that somebody so young could be facing such turmoil. We use the box as a tool throughout our sessions and I later learn what's inside it. Harry is one of many people to say to me, I've never told anybody this before, but I think we're all coping with something that we've been through or something that we're not fully secure within ourselves maybe. And I don't think anybody's immune to that. I learned through a terrible event that somebody close to me who I thought was always coping wasn't actually coping at all. My personal life is very much a do as I say, not as I do. I enter a lot of chaotic, strange and often risky situations and relationships. It wasn't until I was stretchered off into an ambulance that I gained some perspective on my own methods of coping. It's not until right at the end of the book that I realised I'd been missing the most important coping strategy of all. Thank you for your attention, and I can't wait for you to read the book.